all very much aware that we live in a computer-driven world these days, and if you're not careful, then typing and other things can certainly take their toll, possibly causing carpal tunnel syndrome. We're joined this morning by Dr. David Moss. He's an orthopedic hand surgeon with Washington Orthopedics. He talks about going to talk about some of the symptoms, the causes, and the relief for carpal tunnel. Thanks for being with us this morning.
Thank you for having me.
We hear about this a lot. A lot of people are familiar with the term carpal tunnel. We might just not understand what exactly it is and how it affects us. What is it?
Right. Well, carpal tunnel is compression of the median nerve at the wrist, and it leads to numbness, tingling, pain in the thumb, index finger, and middle finger, sometimes weakness as well.
All right, so this is basically something that connects the fingers to the arm or the hand to the arm, right?
Right. It's a nerve that connects the sensation and the motor function of the hand to the rest of the body.
All right, so when we talk about people that suffer from this or people that may have it, you mentioned quickly some of the symptoms that have it. How might somebody know if they're affected by carpal tunnel?
Well, if you're numb in the thumb, the index finger, or the middle finger, those are good signs. Tingling or pain can be an indication as well. Frequently pain at night or waking up at night with pain in those fingers can be a complaint, and then weakness with grip or pinching can be another complaint.
You know, I have always, as we take a look at some of the diagrams here on the screen, I've always heard that this is because of repetitive motion, or we hear it a lot with people who might be typing on their computer all day. Is there truth to that?
Right, that hasn't really been fleshed out. That's been looked at pretty closely, and that's a commonly held belief, but the association specifically with typing or other repetitive activities has not been entirely proven at this point.
So what is it? Where does it come from?
Yeah, it's not really clear. There's several etiologies that can be associated with diabetes or thyroid dysfunction. It can be hereditary. But most cases are really idiopathic, meaning we don't have a specific cause or etiology for them.
So how do we go about making it better?
It's a good question. It's a good question. So there's several early steps you can take. The first thing a lot of people do is wear a splint, a simple wrist splint at night you can purchase in your local drugstore, get from your local doctor, the orthopedic doctor, any other sort of doctor. That can be worn at night, and that can relieve a lot of symptoms from the numbness and tingling that awakens people at night. That's a good first step. Some people recommend anti-inflammatories by mouth, like ibuprofen or a naproxen. That's helpful for some people, and sometimes an injection into the carpal tunnel with a cortisone or another anti-inflammatory can be helpful in some situations.
Yeah, and I'm assuming that this kind of runs the gamut from the things, like you said, from a splint all the way to more serious measures. Is it the type of thing where you might need surgery eventually, or does that depend on the severity of how somebody might be affected by this?
Right, that's a good question. So if the simple first-line treatment efforts don't help, things like splint or anti-inflammatories aren't helpful, then the next step would be surgery, and there's a couple types of surgery. One type is called an open carpal tunnel release, which is where you make an incision about 4 centimeters long in the palm, cut through the skin, the deeper tissues of the wrist, and then cut the ligament that's compressing the nerve at the wrist. The second type of procedure that's more popular or gaining popularity right now is called an endoscopic carpal tunnel release. That's where you make a very small incision in the wrist, about 1.5 centimeters, and slide a camera with a retractable blade on the end down underneath the skin and incise the ligament. That's a smaller scar and a faster recovery.
Which is nice, because people are probably cringing right now thinking about any kind of surgery, especially with the hand. What's a recovery for something like that?
Right. Well, the good part about the endoscopic procedure is that the recovery is quite a bit faster. People get back to work a lot quicker. Probably cuts the recovery time in about half. So where it may take about 4 to 6 weeks for an open release for people to get back to work, people can be back to work quicker, maybe even in 2 weeks, or even sooner, maybe even a couple of days with an endoscopic procedure.
All right, before we scare too many people away and have them fearing that they might need surgery, because in a lot of cases I'm sure you don't need to go to that drastic step. How do we know if, I mean, for example, sometimes my hand just like cramps up and I'm, I start to wonder, do I have something like this? Is there an early detection type thing that we can use to see if maybe we are just cramping or if we have a more serious concern?
All right, that's a good question. Cramping can occasionally be associated with carpal tunnel, but more often it's numbness specifically in the thumb, the index finger, and the middle finger. Night symptoms are very symptomatic, are very consistent with the diagnosis, but if you're really concerned, you should see your healthcare provider.
All right, that's some good advice, and we're going to pass that information along to you at home. We'll put some information on our website as well. Dr. David Moss, orthopedic hand surgeon with Washington Orthopedics. Thanks for being with us this morning.
Thank you for having me.
Really appreciate it. Keep everybody healthy out there. Let's send things back to Tony and Gravere, guys.
All right, thank you, fellas.